And I just pushed record on this Zoom call so we can have a recording to go back to, refer to. There's going to be a good amount of information shared, and so that'll help us capture it if what we may not capture via hand, as well as if anyone's interested in having it be accessible for your review, we will work to make that accessible. So again, good morning. My name is, for those who I don't know, and I see a couple of names, but my name is Evan Kraus. I serve as director for Eastside Aligned. I'm incredibly grateful for all of you carving out the time during such a ever-changing time and difficult time to be a part of this call. So as folks are joining in again, sorry, just if you can, please tell us who you are in the chat box. We will unmute the lines in a little bit to go over, have time for everyone to do a report out. So let me just begin with a couple of Zoom etiquette or conference call etiquette type things, or just things that'll help you navigate. You should be able to scroll and see both a chat box where we're going to use that chat box to help filter questions later on. So you can navigate that. You do have the features to turn on or off your video as well as your audio. We ask that people stay muted if you are not talking, just to help with the sound reduction. And you can also see a participant list to have an idea of who's joined. So just wanted to give some of those functionalities. Be sure you know when you're on mute or not. And we'll go from there. For those on the conference phone, we will get you this PowerPoint. It's not very robust in PowerPoint, so hopefully everything that's on screen you will also hear conveyed. And so I think that's the main pieces of Zoom. The last piece of Zoom is just give us grace. It's a big conference call. We want to be, again, effective with our time and clearly communicating what needs to go out here. So with that being said, I'm going to dive in. The purpose of today's meeting is to explore launching what is called a COAD. It stands for Community Organizations Active in Disaster. This is a model that is adopted and used throughout our nation in times of disaster, and in this case, in times of a disaster caused by a pandemic. And the purpose of it is around improving the coordination of services and resources to effectively alleviate human suffering. And so the task today is how we can better coordinate, better identify gaps that aren't being covered. And, you know, in my mind, and if those who have received my email, it's a twofold thing. It's not just the human suffering and meeting the needs of those in our community that are in most need, but I'm also looking at this and thinking of all of you and your organizations and the remarkable work that's being done with a remarkable sacrifice, and knowing that this pandemic is not ending in a short amount of time. It's going to be with us for a little while, and there was also going to be a period of recovery. It is paramount that we figure out ways to care for the people doing the hard work that you're doing, and ways that we can do so in a way that doesn't deplete resource, but maximizes the resource and get it to where the greatest need is. So that is our purpose. For those of you who are unfamiliar with Eastside Aligned or could use a refresher, Eastside Aligned came about 5 years ago when community organizations came together to talk about how they could work better together to improve the readiness and well-being of children and youth within the East St. Louis School District 189 footprint. And in that work, they put a charge to better align policies, practice, programs, and resources to achieve a goal of a thriving community for young people. And over the last couple of weeks, I've been on various calls, as I'm sure many of you have been, and have really just not surprised, but blown away by the remarkable acts of service and response many of you are doing, some of you out of your own pocket. And it's just beyond inspiring, beyond amazing. It's a testament to the resiliency of this community and what's possible. Over those calls though, and since then, I've also been hearing a lot of the concerns and fears around how can we maintain this level of service. Resources are drying up and needs are elevating, right? And so the desire for this meeting is to explore how a COAD type structure can be beneficial to your efforts, and again, maximize the number of people being helped. I want to be very clear that us convening this meeting is not to be any type of replacement for what's being done. It's just really more of a forum to connect the dots on what's being done. COADs only work with the leadership of the entities in the community, the partnerships between the municipal governments, as well as the community-based and faith-based organizations, along with healthcare and other entities, right? So want to be really clear in that this isn't a call to say, here's how any group is pushing in. It's more of how can we help with all that's going on, not only alleviate a resource strain on any individual agency, but also on those agencies that are like the resource hubs, whether it be food distribution region-wide and so forth. So the COAD is going to continue to require and need and utilize the guidance and leadership from all of you. So I wanted to just kind of preface that kind of as an introductory and say some things right off the bat in terms of my role and my team's role in this is to help be facilitators and navigators going off of the guidance and leadership of what you on this call is seeing, needing, and wanting in terms of this to form. So with that being said, just kind of giving you the overview of our agenda today. We were going to spend just a little bit of time breaking down what a COAD is, how it can work in our community, what's required, what are the nuts and bolts. We're then gonna have a good bit of time to hear from all of you to kind of give a report out on current response activities. This may feel, for some of you, duplicative because you've been on calls where people have talked about what the resources are, but want to call out that this is an ever-evolving situation. And so both resources available are changing as well. So we'll have time for that. And then we're going to talk about next steps. Going into this, just a one note to mention is that the needs are present right now. To get a COAD set up is probably just going to take a bit of time, but if we work aggressively, we can reduce that time. So I want us to be measured in how quickly we can get this off the ground is going to be parallel to how we can get different pieces together. So just know that it's not going to be tomorrow, but hopefully within the next couple of weeks, we can have something really fully functioning. And unfortunately, the reality is this again going to be with us for a while. So how we can mobilize even in 2 weeks is going to be beneficial for the months ahead. So that's the setup. I may have gone fast only so that we can get to the heart of conversation today. I again want to express my deep gratitude for all of you being a part of this call. And so without further ado, I'm going to transition to our first part of the agenda and introduce Regina Greer. She is the Chief Impact Officer with United Way of Greater St. Louis. She has a wealth of experience working within disaster management and response. I've seen that work in action over predominantly on the Missouri side of our river in response to tornadoes and flooding and other situations. And so she has offered to lend her guidance, her expertise, and United Way as one of the organizations during the report outs will talk about their, desires the role. And she also comes to this conversation with a deep personal passion as being an East St. Louis native. So I'd like to turn it over to Regina to kind of walk us through what a COAD is.
All right, thanks, Evan. Good morning, everyone. As Evan mentioned, the deep passion around getting this type of convening and coordination established on the East Side has been a long sought, I would say a long sought effort for us. We've had many starts and stops on different conversations with different folks, and we've not been able to fully launch this, but I will say to you that sometimes situations breathe the appropriate timing, and that's where we are. Evan mentions that this is a well-coordinated jumping off point. It will not be the end, and it will not be the full formalization right now for the COAD that we're seeking to launch today. But it is a starting point, and we do need to start now, and I will tell you that it won't be the last time that this group will be together. I do want to acknowledge Evan and Eastside Align for taking the leadership role to pull you all together today so that we can have this very important conversation. I want to acknowledge our United Way partners on the call, our member agencies, and we do have a few staff members who have also joined, so I want to thank them for their efforts that they're going to do to help support moving this along. And then just thank you to each one of you that have joined. I see we have 64 participants so far, and that is a phenomenal number. One that's probably born out of the crisis that we're in, but at the same time, it is our ability to join together to develop a response, a coordinated response, and that's what a COAD is about, so that we can move forward. Before I get into the overview a little further, I will say that we don't control crises and disaster. We're not in control of that, but we are in control of our collective response to them. And so that is the important part of being able to form a COAD. And never do we want to do things in the midst of the crisis, but sometimes if that's where we find ourselves, that's where we shine the most. Evan sent you some things in advance on the COAD. So there was a pre-reading document that you received as a part of your email invite. And if you haven't had a chance to review that, please do. I'm not going to go through it word for word, but I do want to highlight a few things. So what you see on your screen before you is what is a COAD? And that stands for Community Organizations Active in Disaster. And you may sometimes see this as a VOAD, called Voluntary Organizations Active in Disaster. Some of you who may be in the disaster field or governmental field are familiar with the Illinois State VOAD. And others. And so we would be forming a part of a local network that would start to tie into a regional network. So there is a St. Louis area regional coalition of COADs that's designed to be across our 16 county footprint. And then there's also tentacles up to the state VOAD and even IEMA, which is the Illinois Emergency Management Association. So we would be coordinated organizations that come together during times of crisis and disaster based in a geographic area. And we've named for this area the greater East St. Louis footprint. So East St. Louis, Washington Park, Centerville, Allerton, Cahokia are all that we're looking to start with to enhance communication and cooperation, to bring that coordination and collaboration that's needed to respond, because in times like this and ever, no one single entity or agency will be able to do this work alone. It does take just those 4 C's that you see before you. We're here to enhance the community's ability to prepare, respond, and recover. Sometimes we may, and I'll speak for myself, some people may think that it's other people's responsibility to come in and save us, but I will tell you a hallmark of responding to crisis is that all disasters start and end locally. So it is the community's ability to prepare and respond appropriately with additional resources that come to bear and they're made available. And so all of that to say to everyone on this call, it all starts with us. And then part of a COAD is also assessing and meeting needs to alleviate human suffering. And we do this from an immediate, intermediate, and long-term recovery perspective. So when you think about the phases of a disaster, the first thing is just to simply respond. There's where our first responders come in, but then we also have to assess, and then we have to move into what are the ongoing needs of people, survivors, or those who have been impacted or affected by the disaster. On the handout that you received, just a couple things again. When we look at those guiding principles that we are here to look at, calling out to, so many of you are on the call, and it does take a whole community approach in doing this, and then whole community means different sectors. So again, very gratefully for the number of folks that have joined today, but it is going to take some unprecedented collaboration between government and first responders and human services and faith-based organizations, education, the business community, healthcare, you name it. And while this COVID crisis is not our normal natural or man-made disaster, it is a disaster. It feels the same, the wake and the aftermath and what we're going through is just the same as what we would be thinking of with some nuances if this were a tornado or a flooding event. Evan, can you go to the next slide, please? So what you have before you here, thanks Evan, here are the functions that we're going to be moving through today. And these are standard functions of a COAD. And so as we want to ground the work and look at this, we want to be thinking about what's called mass care, and that's feeding, sheltering, points of distribution. So hygiene supplies, baby supplies, meals and food boxes for seniors or other supplies that may be needed. We've even started to see requests for depends and other things. So what are the supplies that our communities are needing? And then we also know that childcare is a huge concern, especially for our first responders and those that need to respond in this crisis that we're involved in today. We will talk about volunteer and donations coordination. So what happens when we have volunteerism needs or people who want to volunteer, what happens when goods and services start to descend on a community. So we have to have a way to organize and manage that. Emergency assistance, so temporary financial assistance is something that often comes up as the need for a disaster. So rent and utility, these are things that we're seeing right now. Behavioral health supports, information and referral. So how do we get the word out? How are people connecting? How do we figure out and log where these emerging resources are coming from? Because many times resources that are normally available in blue sky are different than resources that may emerge for a temporary time as a response to a disaster. Then we also have spiritual and emotional care. So this is where there's a call out for our faith-based communities or organizations who are providing pastoral care as well. And so that is very often needed in times like this. And we see it now where we do need to rely on that for our residents. And then the last one is public health. And so as we look at, this is a public health crisis. Public health has tentacles in all disasters depending upon what the need is. But we know this one is first and foremost a public health crisis that we are responding to. So just know that what it's going to take for us to do this, and again, this is a starting point. This is not going to be the last time that this COAD is going to function. So you all are hopefully here to learn more, to be ready to respond in this disaster as an immediate, convening, coordinated effort. But we do need to grow into a long-term formal coalition of organizations that are committed to cooperation, communication, coordination, and collaboration. So those 4 C's again. COADs have many functions, and disasters, we don't choose when. It's not about if, we don't choose when, it's about when. So we want to be ready. So just know we're responding out and in the midst of now, but through the leadership and the formalization that you all will do, will set up nicely for the future for additional incidents or crises or disasters that will come. So not to be a pessimist, but just to be realistic, these things are going to happen. And then just remember that whole community approach. So as we think about who's on the call today and then who's not on the call, there's plenty of room at the table for us to bring in all of the folks that need to be tied to this effort. And then even bringing in the tentacles to the state, to the region, to county government, all of those things we have a lens on because that's what it really takes to make this work together. And because this is a cross-jurisdictional effort, there's going to be a lot of effort and a lot of conversation in being sure that we can all be aligned, that we can respond appropriately. And then a shout out to our regional partners, our regional community-based organizations who serve different regions. They're going to be really important for that. Okay, so that's a COAD at a very high level. We're going to have additional conversations. Please read that. But again, thank you for the strong partnership. Evan, thank you for you all's leadership. And we will be moving forward. So I appreciate it.
Great. Thank you, Regina. Again, for those who are on Zoom, please use the chat box if you have questions. Those who joined later on and didn't already, use the chat box to just let us know you're here, putting in your name, organization. Those on the phone, if you have questions, we don't want to lose them. There's going to be time for Q&A as well. This next segment that we're going to be shifting into is kind of the report out, which also will serve sort of as an introduction. On the slide, for those who are not seeing this visually, what I'm putting out is again reiterating our geographic focus areas, which includes Allerton, Brooklyn, Cahokia, Centerville, East St. Louis, Fairmont City, and Washington Park. These are ones that predominantly fall within the District 29 footprint, and then the immediate outskirts, including the Cahokia School District as well. So that's kind of the footprint that we're focusing on. And for this report out, what we're going to be doing is we're going to be going by sections. We're going to first do report out by our government entities. Then we're going to do report outs by our healthcare, community-based, and faith-based. And I'm hoping to group everyone kind of within that. So the chat box is helpful for me to know who's on and who to call out. I will be calling folks to respond. If you're on Zoom, it'd be great for us to see you. So, turn your video on. We'd appreciate that. Again, if you're not talking yet, stay muted. What we're asking to report on, and this is specific to, we're trying to collect what the response activities are. So the three things we're asking are the areas you serve within that footprint that we talked about, the response activities that you have either currently going on or plan to go on, because we know that some folks are still in building phase. So areas served, response activities, and then wanted to give space for any pressing gaps that you're seeing, or gaps, or be it needs that you feel are elevating that you may not know how it's being covered already. So that's what we're seeking to do. Because of the volume of folks who are on this call, we're going to ask people to strive to be brief. We don't necessarily need all the details of how the programs work. Just I'm going to actually flip back to the previous slide so you can kind of think about the response activities based on the categories we have listed. Again, those are categories that are used nationwide. We might have other things that you want to report out, you can. So that is the instructions. Again, feel free to use the chat box if you have questions. Going back a slide just so folks can see. We're going to start with our governments. So I believe if Francella Jackson from the Village of Cahokia is on the line, would you mind sharing out first? I know folks got to get off mute. All right, if she's not on yet, I'll move over to Mayor Eastern. Are you on the line from the city of East St. Louis? All right, see their numbers in the participant code. So I'll see if maybe they're having a technical difficulty. Oh, I got to unmute, sorry.
Okay, thank you.
Sorry, I had you all muted, my bad. I'm learning Zoom myself. Sorry.
Oh, okay.
I
Hi.
just unmuted everyone, so that means you are all. You guys now need to manually mute yourselves, so everyone has access to unmute. My apologies. So Francella, you can go, and then Mayor Easton, please follow.
Okay. Thank you. First, I'd like to thank you, Evan, for your leadership and everything that you're doing. But the Village of Cahokia, we don't have a formal coordination. Pretty much, we have a hotline. Well, not a hotline, a line that residents and others can call at 618-332-4255. 618-332-4255. And then I usually answer the phone. If I'm not there, just leave a message. And so I'm kind of coordinating that by myself along with a very limited staff. So that's what we're doing here, because we pretty much have shut down as well.
And Francella, could you briefly just share, I mean, we're talking kind of resource needs and gaps. So I know you shared with me previously that your village, as well as some of the adjacent municipalities, are really feeling a strain in capacity and so, you know, if you could share what would be helpful for a municipality like yours, that'd be helpful.
I think what would be helpful is just trying to supply basic needs as far as particularly food and maybe even some household items, and seniors being the priority who live alone because they can't get out. They're probably afraid to get out. So if we can at their doorsteps for them to come out and get it. I think just basic needs stuff, Evan.
Thank you.
I don't know if that's what you were talking about, but you're free to add whatever I shared.
No, that covered it. Thank you, Francella. Sorry, I kept you on mute inadvertently. And I likely did the same thing to Mayor Eastern. Mayor Eastern, are you on the line?
I am.
Thank you, sir. Sorry.
Good morning. That's well. That's fine.
So if you could share out, is there anything from you know, basic needs and other emergency assistance that the city is either providing, wanting support to provide?
Oh, okay. I was wondering if Sabrina, if they were gonna call, so I know I'm on.
For those who are on the line, might need to mute the line. We can hear some background. So go ahead, Mayor Easton.
Okay, first of all, I want to echo what Francella just said. As far as thank you, Evans, for putting together this conference call and your leadership, and those that are participating, trying to learn more and trying to be an asset to the this COVID-19 crisis here in our area and in our country. We have kind of mirrored what the state has done and what the county has done as far as establishing the state of the city's emergency. So we've done that. We do have a EOP, which is our emergency operations program that so I've implemented that. So we are enacting that as we speak. And that delineates different duties and assignments within City Hall to different department heads that have inside of City Hall. For instance, everything starts and ends with me. And then I have as a director, who's Lee Coleman. He coordinates everything. The city manager is our public relations type of situation. We have Chief Blackman is over he's over planning. Operations is a Chief Perry, Kendall Perry, and our IT person. Logistics is our city manager and our assistant chief. And finance is obviously our treasurer and those type of individuals. So we've broken everything down to that. So we have, everybody has their duties and assignments within that. We have shut down City Hall. We're going to a virtual type of office situation here. Excuse me. A virtual type of office situation. We are, again, just trying to make sure that first of all, we want to make sure that we are able to function as a City Hall. And we're getting ready to disinfect, do a deep cleaning starting at night of all our buildings, police cars, fire trucks, fire stations, firehouses, public works, and that takes care of City Hall, right? But the most important thing is we want to make sure that one of the most important things we want to make sure we take care of the citizens. I got to make sure that my first responders feel that the city is looking out for them as well, right? Because they're exposed to this unidentifiable enemy, COVID-19. So as far as resources coming in, I have been approached by several different entities as far as how they can help the city. So right now, I'm putting those people with some of the individuals I just named to be able to coordinate that, so we can have everything and we can have a systematic type of way of reviewing stuff and a systematic way of trying to get things out. With this approach, we're gonna probably in the next week or week and a half, we're approached by the Sweet Potato Patch Company, who's gonna be delivering food. We're gonna do 100 meals 3 times a week to seniors for 4 weeks. So we're getting ready to lay that out here real soon. Of course, we've asked for a triage center, emergency triage center here in the city of East St. Louis, as we anticipate from the conversations that we've been having, the sure explosion, if you will, of people contracting this disease or this virus. So again, we even inside our emergency plan, we have a lot of different things that's laid out, right? But nothing really speaks to this. So we're kind of learning on the fly as most of us here. But again, we get our direction from Eastside Health District as far as any health related things, anything that is asked or that is given to me as far as like people want to donate and this, that, and the other things, other than outside of things that are non-perishable items and already enclosed. I run it back to Elizabeth Whiteside Patterson, because I want to make sure that I'm in line with them, because I don't want to do anything to jeopardize anyone's health, and I just want to make sure that we all are consistent here at the city and ourselves. So that's pretty much it from my standpoint.
Thank you, Mayor. Thank you for joining us and for all that you and your team are doing. Just for time, I'm going to move us on. I know Deborah Moore from St. Clair County has joined us. Deborah, I want to turn it over to you to talk. I know the county focuses countywide, but the resources that are available now and in the future will be available to all. So if you could share about what is now and what's ahead and what your needs are, that would be wonderful. Deborah, I don't know if we can hear you yet. Well, we hear you, but it's far away, Deborah.
Can you hear me, but it's far away?
Oh, there we go. And now we can see you. Thank you.
Okay. I'm sorry. Is this better now? Can you hear me? Okay. Thank you so much, Evan, for convening us all and for the leadership that you're offering in this effort. And thanks to all who are participating. Mayor Eastern mentioned some of the things that St. Clair County is doing, but what I will say is for everything that St. Clair County is doing during this time, Chairman Kern delivers every day at 3:30 a Facebook Live state of the county, if you will, and how we are all impacted and how we are responding. Individuals are often a part of that call. The health department is a part of the call. I think, Liz Patton, I think you're going to be a guest one day if you haven't already. We're bringing in mental health providers and service deliverers. The full gamut is covered. He's also providing, having daily conversations with mayors, police chiefs, and fire chiefs as well to convey what we are doing as a county, what supports we are requesting from the state, what we can anticipate from the state, and what we can anticipate from the federal government. So we also have online on the county's website, it is called a COVID-19 action plan. It delineates every county department, the services that are available and how you can access them. Although we are closed to the public, we continue to operate with limited staff being inside the building, but having access to all of the services that are available. And that plan conveys how you can access all of the services that we deliver, and we are making every effort to continue a viable service delivery system. We are anticipating as a county expanded support to individuals who are impacted by uh, the virus, if you will, who are impacted by COVID-19. And we're trying to reach them because many of those individuals don't know that services are available to them or have never ever benefited from or even tried to access such services. So we are expecting expanded resources from the state and federal government to offer community and social services. There will be additional LIHEAP money. There will be potentially additional community development money. There will be additional community services dollars. But a focus we have is really on trying to reach individuals who were not previously eligible or who have never participated in these services. We are also looking at potentially adding additional resources to some of the nonprofits that we currently support so that they might be able to reach broader networks of individuals who are in need of service. And these networks are in the East St. Louis footprint, of course, within the below the bluff communities, if you will, and they are also beyond, in all areas of the county. But there is a high concentration of need, and our dollars reflect that because of the needs that currently and previously existed in our concentration area. So I hope that answers enough of your question, or if there's questions or more, I'm happy to convey.
Thank you, Deborah. Just and as a recap, we know the stimulus packages have passed. Those get funneled to the states. States funnel them to counties and so forth. So what Deborah shared is that there is resources coming. How what exactly all the allotments are to be determined, not yet known. But a COAD structure like this, we believe will be helpful for counties in ensuring that the resource is distributed in all areas where it's needed. So thank you.
Yeah, no question, that's the plan, and we'll operate in that manner.
Yeah. So I'm cognizant of time.
I think there's a question.
Oh, we'll definitely get to,
I'm sorry.
Yeah, I will.
That was a question. I thought it required a response, but I will respond.
I'm seeing it now. So there is a question that asks to Deborah, would you please be able to share the nonprofits that you already work with, through those different social services and grants? And so that's an ask if we can have as a follow-up to our call, just so we don't have to use too much time right now talking about it. But could that be could you provide a list of agencies already?
Absolutely, I can.
Thank you so much. So I just want to note, cognizant of time, we have a good number of folks to go through, and so we did want to give ample time to our municipal folks, and we still have a few more to go through, just because as we know that these are the go-to resource hubs in times of disaster from a standpoint of where federal and state funding are going to flow through. So it's really important that to our community-based and faith-based organizations, you have an awareness of what's coming, and also to see how we can start thinking about how we want to structure and mobilize as a community. So going through, continuing on with some municipal representation, I know we have is Tracy Spears from Washington Park on the phone. Tracy, if you are still with us and can share out any efforts underway and or needs that you have, we'd appreciate it.
Good morning, everyone. I'm not really privy to anything that's going on in Washington Park. I work at the police department. I can tell you that I haven't been to work since Friday because I got sick, and of course, no one wants to be around anyone sick. When I left work Friday, we were using the end of any supplies that we had, that the police had. We were out of the N95 mask. We were low on those. We did have cleaning. We had Lysol products to clean the vehicles out and keep the police department clean in case anyone was brought in dealing with a serious crime or whatever. I can tell you that everything starts and stops at the Washington Park City Hall. I'm not privy to what they do over there and what efforts that they had been coordinating in order to address the citizens of Washington Park. I know that during other times that the mayor and the trustees do all get together and make plans to assist the citizens with different things that they may need. I'm not sure if that's what was going on. I did plan on going into the office today so that I could see was there any help that I could contribute and as far as addressing our needs in our community and making sure that we're taking care of our citizens out here, as well as taking care of our first responders, because again, they're on the front line and they don't know what they're walking into. In order to keep the community being serviced, we have to start with our frontline service.
Thank you, Tracy, and thank you for echoing the needs of first responders. Is definitely ensuring that those resources flow. We want to make sure it's in that list of priorities. There were possibly going to be folks representing either Allerton and Centerville on part of this call. If either city managers or administrators are on the call, this would be a good time to unmute, introduce yourself, and share out.
Evan, they're not on the call, but I can relay any messages from this meeting to both Allerton and Centerville. Okay.
Thank you, Francella. So still within the vein of government, but quasi-governmental, we have, I would like to open up for District 189 to talk about what the school is doing. And so I know we have both Sydney and Tiffany on the line. Not sure who would like to tackle.
Sure, I'll start and then Tiffany can chime in too. So yes, I'm Sydney with the East St. Louis School District, and many of you might already be aware of some of the efforts that we have underway. I put them into three buckets. One is education. So we are continuing to make sure that we're educating our students during school closure. This is of course a chief priority for us. We have distributed Chromebooks to students in grades 1st grade through 12th grade. Not all families came to pick up a Chromebook, and there might have been various reasons for why that they were either unable to or other reasons. But approximately 70% of our student population now has a Chromebook from our school district, so they can continue education through that means. Teachers and administrators are providing at least weekly communication to the students through resources such as Google Classroom and others. Information about websites that we're using for curriculum and other continued activities can be found on our website. So if you want to look at details for that, go to our East St. Louis School District 189 website. Priority is of course continuing to feed, to make sure that we have meals provided to the community, to children and youth in particular. So we have Monday through Friday a meal service program that is a grab and go lunch, and it serves from 10 a.m. until noon. You can pick up a meal, and that includes breakfast, lunch, sometimes a snack. And then on Fridays, the meal is heavier. It includes more through the weekend. So we are seeing about 4,000 people coming to get meals on a daily basis at this point in time. Each day basically is increasing. Mondays are a low day for us. Fridays are a larger volume of students, children coming to get food. Know that it can be a parent, it can be a child, whoever can come and pick. So it's not restricted to don't have to show an ID. We're just wanting to try to make sure people get fed. Continuing on with kind of linking that then to some of our gaps and needs. Some of you might already be aware that other school districts in the state of Illinois, there are more school districts providing this meal service too. And there have been some COVID cases connected to either bus drivers or the meal preparers that have then received a diagnosis of COVID-19, and then it has implications for come in contact with. That has not been an issue to East St. Louis School District. We are mentally trying to prepare ourselves. So if something like that were to happen, how can we make sure, and if we would need to suspend or stop or minimize our service, is there another group that can fill that need? Or if we would need to go to an alternative option, such as purchasing food that families that would receive. So those are some things that we're beginning to think about. Again, it is not a concern at this moment in time. A current gap that we have is we may have additional meals available, and we do not want to bring those back and reuse them. So we want them to get utilized on that day. Additional meals at noon on the weekday, that would be great. Please let us know, because we need to have a system for where we can drop off additional meals if we have leftovers.
And Sydney, you cut out a little, just so everyone's clear, that there is a certain number of meals. They could be as little as what, 50, as much as 200 meals left over in a day?
Correct. Yesterday we had 400.
So yesterday was a day, not a lot. Mondays are not always, probably just like on a school day, right? Always see different on Mondays. So, you know, one of the benefits of a COAD is like figuring out a schedule, and everyone can kind of share the load of where that gets distributed to. If we're coordinated on, all right, Monday is going to be this agency, Tuesday, so on and so forth. And it could be more than one, just based on volume and need. So for those, again, community-based providers on the phones, as we're thinking about how we can allocate and distribute these resources equitably across our footprint and where need is, this is one of those opportunities. You're going to hear about food distribution for the family. I just wanted to give that for food for food for thought.
Sure. And just to clarify, I see a few questions popping in. Any child can receive a meal. It doesn't matter if they're 18 months old, 3 years old, if they're 20. So again, it can be a parent. If a parent comes up to us and says, I have 5 kids at home, we don't ask them for proof. We're going to give them 5 meals. Okay. So please make sure people take advantage of that. This week there has been a change. So normally we've been distributing it by school bus to each one of our locations. There's participating sites. You can again find those details on our website. We are down 9 bus drivers this week because it was officially our spring break. And so at our school locations, there is not a bus parked out front, which is a change. We are still serving at those locations, but oftentimes when kids or family members don't see a bus from down the street, they think it's not there. So if you can help spread the word that meals are being served at the schools this week, it just may not be by bus. They should have a table out front, which can be accessible. And we're still, of course, practicing social distancing during this process. Just a couple more points before I pass it over to Tiffany. A challenge that we have is Wi-Fi access in Washington Park. And I know that there are some providers that have been trying to open up access, but our families are reporting that they're having a lot of difficulty with that. So we would love the village of Washington Park to really try to advocate with local providers or other groups that might be able to advocate that we've got to get some kind of better service for Wi-Fi in Washington Park for our families there. I'll just briefly highlight communication before I go to our social emotional learning efforts. If you need to have updates from School District 189, we are doing that through our website as well as through Facebook and Twitter. So I encourage you to look at those 3 tools on a regular basis, because as we all know, the information is constantly changing and we might have to make adjustments. And so that is where you can find current information, is on our website, Facebook, Twitter. And we are sending out robocalls. You know, during challenging times like this, it's hard to get the information and key messages to everyone in a way that works best for them. So we're doing a lot of robocalls. We've been asked by local municipalities to send out robocalls, for example, hampering activities by youth, like congregating for playing basketball and things like that in the park. But we're also getting pushback from specific family members saying that they're resting. They're trying to rest and they don't want this disruption of phone calls. So we're just trying to balance the various needs. And of course, we've been really pushing in the last several years our social emotional supports. And so Dr. Tiffany Golson can add to this, but I just want to point out that we do have a text helpline for students, for the benefit of students. And if they contact that text helpline, they will be in direct contact with some of our school support staff, such as a school social worker. And that text helpline is 618-249-4443. I'll put that in the chat box, and it's again available on our website as well as Twitter and Facebook. Tiffany?
Okay, good morning. Okay, yeah, just to piggyback on that, actually that support helpline, I'm playing dispatch, so it comes to me, and if it's something quick, I address it. Otherwise, yes, I will send it out to social workers or our truancy homeless workers, depending on what it is. Sometimes the students are calling because they want to speak to a specific teacher, and so I'll try to connect them in that way. So that's going well. The biggest issue I think that we're seeing is sustainability. So Evan, I sent you a picture. I don't know if you're on your phone too. I texted you a picture today, but I was out at the food lines just so you can see the operations that are going on every single day to get those 4,000 meals out, and just talking to the staff. They're in pain physically, picking up the milk cartons full of ice, these coolers, and again, 4,000 meals. Today went out, I collected as many face masks that we had to get to them, because I think what Sydney just mentioned, with Masuda and Belleville, made people a little more nervous. So we collected the face masks that we have, but again, that's not going to last very long. And just maintaining this load, I don't know how long will last. Talking to the food service folks, I was wondering if they could knock out maybe food. Some other places are doing, say, food on Monday, passing out for Monday, Tuesday, Wednesday, and then coming back Thursday for the weekend. But that would like quadruple his staff. And I asked if volunteers would be helpful. And so it's something that we may think about in the long term. Sydney also talked about the internet. I know Spectrum and Charter were offering free internet, but it's not working. Most of the students that I've talked to, they get a busy signal, no answer, or someone says they'll come out, and it's been 3 weeks now. Kind of throwing out the idea of mobile hotspots. So I'm just kind of throwing that out into the universe. If we put them in the schools, it's only like a 1 mile radius. And so then people might congregate to use that. So I don't know, just putting it out there, maybe we can figure out how to get hotspots in folks' homes or opening up the internet. Hotels and shelters. So the hotel on 62nd, does anyone know, if you guys tell me in the chat, the hotel on 62nd and State across from the senior citizens home has just shut down. We did have some families there. I frankly didn't like their attitude and the way that they were helping or not helping, but my truancy worker did get American America's Best to give us a discounted rate and hold rooms for some of our families every night. So if anyone has any other, I do see New Life is on here, so I'm waiting to hear from them. But if anyone knows of any shelters or hotels that we can work with and do something better than their $51, $55 a night rate, it's getting costly. The Metro, so talking to some of my students, so someone asked about the Chromebooks and those 30% of kids. I'll tell you that everyone isn't interested in getting Chromebooks. Some people are afraid that they'll be responsible for them. So I've heard parents say that they don't want to take responsibility for these Chromebooks in their home. And others just aren't interested. Right now, a lot of people are still using it for entertainment purposes. And I just know a lot of kids that I've talked to have instead decided to go to work. This is a good time to make some money. And so these fast food places are hiring. So then my next question goes to Metro and the public transportation. Are they around? Are we talking to them? Are they doing the cleaning and the safety precautions that they should? Our ESL, our Spanish speaking students, I think they're out in Caseyville. A lot of the messaging is not in Spanish. And I've also understood that there's some resources they cannot get if they're undocumented and don't have social security numbers. So if there's a one-stop shop for our Spanish-speaking families, we do have an excellent person, Martha, that's helping get the message to them, but I think they're kind of feeling like a subgroup here. And then lastly, on my end, we meet this week to talk about online enrollment. I think now is a good time to, since we do have 70% more computers in the households, that we try to get students and families to register for next year online, give them some hope. Let's look to some point to the future, but it also update phone numbers and email information so we can better talk to people. But again, thank you, Evan, for putting this together. I know I was frustrated last week.
So thank you, Tiffany and Sydney. And for those using Zoom, I'm appreciating that folks have moved to chat box. That I would continue and encourage it because you're going to continue to hear needs getting thrown out. So if you want to use the chat box as kind of offering what support you have to meet any of the needs raised, we can also use the chat box to help us document what we're hearing. Again, we have over 70 people on this call. We're trying to work through it and still be timely. Obviously, this first call, I think we're going to really tackle kind of what our civic institutions are. We're going to do the best we can to get through our community-based organizations. But I just want to say, chat box can also be a space where we're capturing some of that information. Just for facilitation purposes, we're going to move to talk to some of our health entities and then dive into our community-based organizations. So kicking us off with health, I saw Liz Patton Whiteside in the Zoom video a few minutes ago. I don't know if Liz, you're still on or you had to step away, but I know you are deep in the trenches with public health response. So if there's anything that would be most important for us to know either about your response activities and more so the needs that you have, want to open the floor for you, Liz.
Okay, can you hear me now?
We can.
Okay, I'm not good with technology, okay? Not only do I serve the area in which you're talking about, I also serve sites, which is in the Lovejoy area. So I serve about 60,000 individuals for this health department. And right now, as of today, my latest count is we have 12 positive cases.
I'm on a call.
8 negative cases.
Could I call you back in about 10 minutes?
Can you please mute your phone, please?
Yeah, if your phone's not muted, we just heard someone take another call. Just let's make sure we mute if we're not talking. Thank you.
Okay, so I have 12 positive cases in our area, 8 negative and 2 pending. Now, the last time I gave a report out, which was last week, we only had 2 positive cases. So that lets you know that our cases are going up in our area. Now, Of course, I work diligently with the St. Clair County Health Department, and we are coordinating our services. For any positive cases, pending cases, and even negative cases, we do a lot of background stuff that people do not understand. We have to contact everybody that's associated with a positive case, and even those cases that are negative. And for those that are pending, we're still contacting them to make sure that their symptoms have not come back or increased or further them along within the healthcare system. So I'm really bogged down over here with trying to make all of these contacts with all of these different individuals. And then one of my problems is people are bombarding us with, why don't we put up a testing facility here at our district or within our area? Only thing I can say about that is, one, I don't have capacity to be able to do that. And two, I don't have physicians. I only have nurses. And that is something that needs to be coordinated with the medical providers of the city. I wish I could do it, but I can't. There's no way that I can do it. We are working around the clock. Like most people can rest on Saturday and Sunday. We're working 24 hours, 7 days a week here at the health department, doing a lot of things. Our clinics are still open, all of them except for the school-based health center clinics. But I have decreased hours with my clinic in Cahokia. It's only open Monday through Wednesdays. The clinic in Fairmont City is only open Tuesdays and Thursdays and Fridays, I'm sorry. But 20th Street is open Monday through Friday, and the STD clinic is open Monday through Friday. So we're still trying to do a lot of the public health services that we've been doing on a normal basis, plus take on the COVID virus stuff also. So you can give us a call if you have any information or want any information at our main number, which is 618-874-4713, and ask for extension 100, which will give you directly to the receptionist who can funnel your call wherever it needs to be. I heard Ms. Moore talk about the services that are available from St. Clair County for the COVID individuals. One gap that could be filled is because we are calling the individuals and have contact with them on a regular basis. If that information could be given to the health departments, when we're talking to the COVID clients, we could automatically give them that information so that they won't have to be trying to find out information of where they can get more services. If there's one number that they can call or a direction that we can steer them to, because I think that that would help them a lot. But again, it's imperative that everybody stay home. One of the problems is the weather is getting warmer. Yep. People want to go outside and congregate. But we as the leaders of the community have to keep sending the message out that you cannot congregate, because if one person in a congregation of 10 people become infected, that one person can potentially infect the 10 people in that spread that they were in. And then someone from that is going to get infected, and then it just passes and passes and passes. We know that staying in the house is not a way to prevent it. That's a way for it to slow down so that we can get our resources together and be able to develop a vaccine or something to help combat this virus. You all have to realize that from a medical standpoint, we're shooting in the dark. We're messing with something that we have never messed with before. And a lot of times it's trial and error before we can get to something that really works. So I'm saying be patient with us, because we're trying as hard as we can. And we're also getting infected from dealing with the people that we're trying to help, which is limiting your first responders. So pretty soon, it's going to get worse than what it is. And I'm not a doomsday person. I'm just a realist. It's going to get worse before it gets better. But we have to get that message out to stay at home and limit all contacts. If you have any questions as far as the babies are concerned and the mothers with formula, because we've had problems out here where they go to stores and they cannot get their formula, then they need to call the health department and we will try to work with them and try to get it for them or steer them in the right direction in which to get formula for these babies. We also have limited, and I must say limited, diapers here that we can out to some of the individuals. We are getting shipments in of PPE, and it's our duty as the health department to take this personal protection equipment that's coming in, take an inventory of everything. We're calling the different police departments to see what do they need and try to get more PPE out to the first responders. But people have to realize when it comes to the masks, you don't have to wear a mask. The masks are for the first responders. You wearing a mask going out in the setting is doing you no good unless you are the one who is sick. The person who is sick should wear the mask, not the people who are not sick. And trying to get that across has been very difficult. And please don't ask me about toilet paper. I have no idea why everybody is hoarding toilet paper. We haven't figured that one out yet either. On a lighter note, to make you all laugh, because this is a very serious discussion. Okay. Any other questions? You can just shoot them to me, and I will get answers for you. I might not be able to get back to you immediately because sometimes I have to do a little research on, depending on the question that you're asking. But please know that Eastside Health District is here and we're working 24/7, even though you don't see it. We are definitely in the trenches. Okay. Anything else?
Yeah, no, Liz, you covered it. If those have questions, use the chat box. You can funnel emails through me. You know, you kind of heard, the more we can centralize the number of folks Liz has to respond to, probably the better. We want to create a communication channel with this group where we send email updates. So, or think of like a frequently asked questions page. We want, you know, if one person has a question, likely others do. So we want to somewhat limit her burden in a sense. You see they're working 24/7 round the clock, and they have higher priority needs of responding specifically to those where folks have been tested positive or are being tested. So, you know, Liz, we're hopeful that this COAD can be a resource support. You talked about kind of a one number connection. There are some numbers out there that we want to make sure is communicated to all. The thing that I know, Liz, that your guidance will be continually helpful on is how we navigate the right and ensure the right precautions during a time where the best thing we can do is stay at home. But, you know, the group of folks on this phone are ones who either themselves or their staff are all staying home because they are being where they feel they most need to do to help people survive. So ensuring we're applying best practice to that is going to be incredibly important. So thank you, Liz, to you and your team. For those who have been utilizing the chat box, and I'm sharing this from a standpoint of those on the phone, great discussion. People are putting in their needs as well as their resources. And so you see that some of them have put out kind of their information. The St. Louis Area Food Bank is one of them. They might get a flood of calls from this meeting. I'm not, you know, it's not our role to stop anyone from trying to coordinate something from their area. But as we grow this COAD, it would be great if we can start to centralize those requests. So I think, you know, organically that may start to happen based on who from this call we see as having capacity to host one of their mobile markets, which I know we kind of went the health route, but we'll do want to get back into. I'm going to pause the health stuff momentarily because of the conversation happening with the food. I would like to give space for St. Louis Area Food Bank to give an update on their response efforts and what would make it most effective for you all during this time.
Hi, everyone. This is Nicole Hawkins. I'm with the St. Louis Area Food Bank. We are currently partnering with several communities or several partners in the St. Louis area. We have 7 pantry partners that we provide food to that are still open and operating. We have had a couple shut down. So we've been adding mobile distribution sites, and we have 8 mobile distributions scheduled for April. I believe, Evan, that I sent that list out to the original group, and you're welcome to share that with everyone, but I put in the chat box how you can also find those lists if you're interested. Our mobile distributions is how we're trying to push out food right now. So if there are any partners out there, what we do is we can get anywhere from 4. Remember, we're not a grocery store, we're a food bank. So we do everything by the pallet. So we can give 4 to 10 pallets of food, a large amount of food at a time. It's all boxed in cases, or if it could be fresh produce, bagged. It can go out to sites. We can drop that off for you, and then you can distribute it out to families in need. We've partnered with some schools. I know we have like a mobile market at Wyvetter Young once a month just during regular times where we drop the food and then families can come by and pick it up. And usually there's a 2-hour window of when people are allowed to do that. We also have a support person who can help walk you through how the process could look for you and also explain how to do a drive-through model to limit contact with each other, and it really helps with social distancing. We can have people drive through, and then if you have walk-ups, people who may not have vehicles, you can set things aside for them to come up and grab and may not have as close of contact. So we have a lot of resources and tools to explain how to do all of that. What would be ideal is to look at those lists, and if you know that you think your area may have a need, that we can coordinate what that might be to maybe do some centralized distributions in the area instead of lots of little ones. That would be ideal for us. It would just probably make everything a lot simpler for the community as well. I do know that we have had a very strong presence in Cahokia previous to the COVID response, but it's all been through the school district. And since the school district has shut down, all of our school markets and resources there have stopped. So that might be something we should definitely look into as a need.
Thank you. A quick question. You kind of just spoke to it in terms of, like I said, folks have your information now. Your call volume might increase a little to set up some sites. If you're, all right.
I'm sorry. I'm working from home with a kiddo. Sorry.
Oh, that's yours. Okay, I thought it was someone else. You get the pass. Just in thinking about how we can move it from multiple requests to one request, is there a particular person that you see having available for like the East St. Louis area footprint we should start like engaging and strategizing with?
Well, it definitely sounds like the school district has a really good foothold already and is distributing food, so we could look at doing some more distributions there where we're dropping off food once or twice a week, maybe at different schools. However, they're passing that out where they can hand that out as families are coming up. If you're doing 4,000 meals, that would be an easy add-on where people wouldn't have to go somewhere else, but they would get food for their families and not just their kids. We're really focused on trying to make sure it's not just kid focused, which I know because of the federal guidelines has to be for some of those programs, but we could add and supplement through that. That would be good. So school districts are always an easy way to move that.
Great, thank you.
And that is, the number I gave is my cell phone number, so I'm more than happy to chat with anyone. But again, I think it would be best if we centralize things to make sure that we can do it the best way possible and get to the most people.
Great. So to everyone on the calls, right, if you are primed and have a site, some people have said in the chat box that they can be a site. Some said that they can, some were on the phone, maybe taking down the number and want to call. We're not at this time trying to limit anyone from doing that, but we do want to see how we can start within the next couple of weeks, starting to streamline the requests so we can make sure we're hitting the different places and best utilizing the food bank's resources. Another entity I know that's—
Excuse me, Evan.
Yeah.
Excuse me, Evan, this is Francella. My pastor, Reverend Jerry Wilson, has a question. He's on the line. Pastor Wilson?
Hi, good morning. Thank you so much. Just one quick question. The lady that was dealing, Nicole, with the food bank, our church in Centerville, St. John, was one of those hubs that was used to share with the food bank privileges. And I know that last month when this pandemic first started, that they canceled us out. And I just want to know if that's still the same for this month. I mean, we're more than happy to, again, see what we can do to facilitate those efforts so that we could serve our community or the communities that surround the church as we were. Just wanting to know.
So those distributions were arranged through the Cahokia School District, is that right?
Yes, ma'am, it was.
Yeah, so Cahokia canceled all of those, not the food bank. We're more than happy to continue and keep doing those if you would like to. So if you want to shoot me an email, I can get those rescheduled for you and make sure they're on the list. Okay,
can you send me, what's your email?
Yeah, I can tell you right now. It's N, as in Nicole, Hawkins is my last name, HAWKINS, at stlfoodbank.org.
So Evan, I want to just reiterate, part of the reason for the COAD is for coordination. So I see folks have been dropping in the chat box. So if you want to use your site to be a site, please just put in the chat box your site, the areas that you can serve, and then we will coordinate with the food bank to get the centralization happening.
And Regina, this is Nicole. Are you guys going to combine all that information in the chat box and send it over, and I can get back with everyone?
Yes, Nicole.
Or we could schedule. Yep. Or we could schedule an offline call, whatever. Great, perfect. Thanks, guys.
Okay, thanks.
Another regional entity that's providing food and other basic needs support is the Urban League. And I believe Linda Harris was on the line. If you're still with us, would you mind giving a report about what's coming? They've had to drop off. I'm just looking through our list to see if folks from the Salvation Army, Christopher White, I know you're on. I'm not sure if there's others as well who can speak about some of the services you are providing.
Hi, Evan. Yeah, thank you. I got the information of the services that we currently and continue to provide primarily at our East St. Louis location in preparation for this course. So I know we're taking about 40 meals a week to program participants who, as we talked about, primarily young people, but seniors and those who regularly attend our programs. Also, we're giving out regular food boxes and personal care items to those who are active in our social service programs. We have a food pantry, which is operating in East St. Louis. About 50 people or 50 households a week are still making use of that. I think it's stayed steady. I don't think we've seen a huge increase yet. We've also got a soup kitchen as well. I think that's actually in Belleville, which I know is not covered under this, but we're feeding about 25 people 3 times a week at that location. And then in East St. Louis, again, we're helping provide hotel stays, about 20 per week, and they've seen an uptick in what's being distributed there. I will say there are regular programs, and then I'm actually the liaison officer for the incident command team that's been set up by the Salvation Army St. Louis region in response to this disaster. And we do have some other resources which we're trying to help provide, primarily right now, food boxes that we're delivering out. But in addition to emotional spiritual care, I know you mentioned that earlier as part of the COAD, and obviously we're part of the greater COAD, the different meetings that are happening across the region. And so I'm going to give my email, and if there are specific requests that you can help us with, I'll help connect you with the East St. Louis, Belleville locations. And then if it goes beyond what they can help, we can then jump in as well with this. Our headquarters resources is kind of where I'm working out of. So my email is simply Christopher.White at usc.salvationarmy.org. And as I'm saying that, it would be easier if I put that in the chat, wouldn't it? So I will do that, and everyone can see that. Just shoot me an email and I'll try and send it on if we have supplies that we can help with. And we are reaching out to the 7 counties in our area, including the Illinois counties, specifically St. Clair as well. So if there are requests or needs that we can help with, please do reach out to us through that email and I'll forward that on. I think that's everything from me, Evan.
Thank you, sir.
Okay, thank you.
And just, you know, email addresses can be long, but for those who are on the phone, we again want to reiterate, we want to make sure, I mean, obviously you learned about this through someone forwarding information. And so hopefully we capture your email in some way. So follow the trail and however you got informed about this, and we want to make sure you're part of a thread. I'll also offer my phone number that you can text me your email address to make sure you're on future communications is 314-456-1610. Again, 314-456-1610. I'm providing this primarily so we can capture email addresses that we may not have captured otherwise. Please use discretion in blowing up my phone because we need to be focused on other things. But just we want everyone to be connected and accessed. I'm mindful of time. I said at the beginning of this meeting that you know, this might be challenging to get through, but we have a really good starting point in terms of gathering information, both from what's been said as well as things lifted in the chat box. I want to ensure we can run through in sort of a very quick popcorn type fashion what's being done. If you have already listed your information in the chat box and don't have anything else to add, if I call on you and you've done that, just say, we're good, refer to the chat box. And just so folks are aware, like, this was an information gathering call. It was a kind of affirming, do we want this coordination call? I'll go over next steps, but it is going to be how do we translate this information, and I'll put the next steps on the screen so folks can kind of see what. But we're going to be
Evan, before you go there, I'm sorry, can I just make a note? So 211 is represented on this call along with the volunteer center. So I just don't want to move that. I think those are 2 important points. The information that we'll have, there's lots of information at 211. It is available 24 hours a day. So I do want to be sure that this group knows how to utilize those functions. And also Rick has put information, or Caitlin, about volunteer needs. So please see that in the chat box. Okay.
Excuse me, this is Francella again. Evan, Linda Harris is back on the phone.
Oh, great. I'll call on Linda one sec. So just in follow up, just so people are knowing, we're going to be bringing all this information together and then looking at how we move it into different teams to support and lead the coordination. So it's going to be a share back out of all this information, but then really an ask to see where, you know, people can see themselves playing an organizing role. So that's to come. Getting back on just kind of going through different things. Regina, you mentioned 211's on the line that's here from Urban League. Then we'll talk 211 Volunteer Center and then try to get through as many others as possible. So Linda, thank you for joining us. We were just asking if you could share out what resources are being or will be provided to the footprint.
Hi, good morning. Thank you so much for the opportunity, Evan. We do sincerely appreciate it. Our offices are closed. However, we continue to provide services via online counseling for rental assistance, mortgage assistance, and utility assistance. We are able to do food pickup as well on a scheduled one-on-one basis. We do still have water available for the Centerville residents, and in fact, we were distributing water yesterday for the Centerville residents. But again, the online counseling is working for rental assistance, mortgage assistance, and utility assistance. We're definitely interested in doing a centralized distribution for food. So we will certainly reach out to the food bank to see what opportunities are available for us to do so. Individuals can call in and leave a voicemail message at 618-274-1150. We're able to schedule those online conference calls through Zoom, which also provides a phone number, of course, for individuals to connect with our staff, so that we, maintain the privacy of the staff's personal cell phone. So that's pretty much what we have going on.
Thank you. Moving on to 211.
Yeah, so just really quickly, 211 has handled over 17,000 calls since the pandemic was declared on the 12th. We are available 24 hours a day, fielding calls for general needs, connecting to resources just like the ones that are being expressed here, and then also asking basic COVID calls, basic COVID questions. So we're not diagnosing or anything like that, but we have been working with St. Louis County and others in terms of some basic questions that have been coming our way naturally. So just know that it is a clearinghouse. We will be supporting and connecting. We have a numbers to know document that will be updated on our website. Lots of resources there too. So I'll put that in the chat box. It's 211helps.org. And so please utilize us as a United Way resource. And it's also an endeavor to keep the connection to the community 24 hours a day. So I'll add that to the chat box. Thanks, Evan.
All right, Rick Skinner from the Volunteer Center did put his information about volunteering in the chat box. So don't want to be redundant, but anything to add, Rick?
Just real quickly, and thank you, Evan. So to Liz's point about making sure that people stay in place, we're encouraging agency partners to think through their existing volunteer opportunities and are there ways that people can accomplish those tasks remotely or at home. So our resource, which is stlvolunteer.org, which is the regional volunteer hub, has featured opportunities, drives for supplies that companies can assist with, but also a very important area of things to do at home or things to do remotely. So if you have those types of opportunities I've included in the chat box, how do you post those and how do you be a partner in that resource? Thank you.
Thank you, Rick. Want to, again, just streamline through some of this information was in the chat box. Wyvetta from Community Lifeline, anything additional than from what you put in the chat box that you are doing and or prepared to do?
The only thing that I probably should add is that there are housing resources available for homeless individuals in the East St. Louis area that we can assist with them just finding housing during this crisis also. The other things was I noticed it was a lot of questions about laundry. We have done a partnership with Empire Laundry on 38th and State in East St. Louis. They do have a drop-off service. So, and we do have vouchers that will help families just to be able to wash and get their clothing ready. The other than that, I put about the food boxes. They're preparing today to be able to pass out to anyone in East St. Louis that need food or in the surrounding areas that need food. It's about a week's worth of groceries for family of four. And we're not saying this part, but we also have a gift card in there for meat so that they can go get their own meat supplies.
I'm cognizant of the time and I do see people are dropping off. So just a few more to get through and we'll wrap up the call. I see that Tony Muhammad from Catholic Urban Programs is in the participant list. Be great if Tony, you could share about Catholic Urban Programs, both what you're doing and what you're needing. All right, Tony, I don't know if you're on mute.
Evan,
oh,
and
yeah.
this is Diane. I got an email that Tony had to drop off.
Okay.
But she did say that they're continuing to meet needs with a skeleton staff. They have a food pantry open on Tuesdays and Thursdays from 9 to 12 and 1 to 3. They do have some motel vouchers, and they're taking that information by phone at 398-5616. Also, utility assistance on Mondays. She said she would like to be a part of the COAD and will continue communicating with you.
Thank you, Diane. That was Diane Sonneman, representative with Catholic Urban Programs. Just going through, Children's Home and Aid has put a lot of information in the chat box as it relates to childcare services for workers, as well as other resources. Anything else, Renee or Janice, that you haven't included in the chat box?
This is Renee Story. Thanks for doing this, Evan and Regina. Just want you to know that both 800 lines with CCR&R and CCAP are available. We're coordinating childcare for essential workers and first responders. And if you have any other early childhood needs, you can call either one of those 800 numbers. They're being manned daily. Also, we're providing all of our services, most of our services remotely. We do have crisis intervention for youth and homeless youth. We can open new cases if any youth ages 10 through 24 has a need, their family's having difficulty with them, they're having family concerns, we can provide those services remotely. Our biggest needs really are around basic needs, getting just a lot of requests from our clients, but this has been terrifically helpful for that. And then also technology needs, which I think have been talked about a lot. Janice, anything to add? Janice may have had to drop off.
No, she's on.
Hello. As Renee mentioned, we are really responding as quickly as possible. The Department of Human Services has done a phenomenal job bending policies or changing policies at least through the end of May. So both child care providers and families will benefit from those adjusted policies. As Renee mentioned, there is a 800 or 888 helpline for those looking for child care. And we have a list of programs that are serving as essential child care sites. For this week, I think we're good. I think the greatest needs are around some of the basic items I mentioned in the chat box. So feel free to call our 800 numbers or the 888 number for any early childhood needs that you know are needed.
Thank you. There was mention earlier about supports for our Spanish-speaking community. I know different school districts is doing their work, but another organization, Hoyleton, has a specific called Puentes de Esperanza. So you were on the line earlier. Anything to update about what you are doing and or seeing from a needs standpoint?
So this is Kristen Shin with Hoyleton Youth and Family Services and Puentes de Esperanza. Our team is working remotely to get services to families. So if you have a need, if you're an organization trying to provide additional services in that time, feel free to contact us. You can call my direct number at 618-688-4739. Or if it's a Spanish-speaking family looking to speak with a team member, 618-398-0557. We ask that everyone leaves a message. Since we are working remotely, we can't get to our phones right away, but we'll give you a call back. We're also seeing the same needs for the food distribution. We do have a lot of school districts. Our area is larger than this COAD footprint. However, the school districts are stepping up and providing food services. One of the biggest barriers for our families is they may not have the transportation to get to those services. So we spoke yesterday with some local organizations trying to navigate that. I'm staying in connection on a state and national level in regards to what can be provided to our immigrant families. There are a lot of services out there for individuals that are being impacted by COVID-19, including those that are possibly losing their jobs. Unfortunately, we have families in our community that are not eligible for those services. So if parents aren't eligible for those services or the family aren't eligible, it puts our kiddos at risk as well. So we're trying to work through that and navigate that. If you believe that your organization has any flexibility around that, I ask you be considerate of that. We have a number of families that are being impacted right now, and we're doing our best to help fill those gaps. So I'll send you more information, Evan.
Thank you. Seeing that, just for folks who haven't seen the chat box, there was an announcement from Touche Regional Hospital about a mental health, pandemic mental health support and resource line. For those joining us by phone, that number is 618-482-7158. Again, this is a mental health support and resource line, area code 618-482-7158. It's 11:38. We haven't reached everyone to do a share out. For those who are using chat box, if there is something that we feel that is really important to get out, we place it there. For those joining by phone, again, you can text me at 314-456-1610. Again, that's if you don't already have my email. Email would be preferred. We're going to streamline. So I'm gonna, I know I'm missing voices here. I want to just share who's represented that I've seen. We have representatives from Southern Illinois, SIHF Healthcare, Touche Regional Hospital, Comprehensive Behavioral Health, Health Visions, American Heart Association, Mount Sinai, Join Hands, Unipres Kinder Cottage, Leslie Bates, representatives from Illinois State Police have joined our call. I've seen a number of different faith leaders. I feel bad if I'm leaving someone off, but we definitely have had more organizations here than we've had the ability to give a report out. East St. Louis Housing Authority as well. Our community is here. Our community is on the line, is on the Zoom. And what this is, well, the one other voice that I want to make mention is we've had a number of young people on this call too. I don't know if folks saw the call to action in the chat box, but one person called out, what is the role of young people? This is their disaster too. This is their community and movement too. They're wanting and seeing an opportunity for them to play a role. My response to that is, I believe they can tell us in a sense where they feel based on what they learned that they could play a role. But my charge to everyone, all the adults on the lines, is to please be thinking about the ways not only do we support youth during this time, but create space for them to help guide us during this time. They know best what their needs are. And I want to thank the young person who lifted that up. And I think our next meeting, we would definitely create and prioritize space to hear from them directly. I did want to say I appreciate the thanks that has been drawn my way. The reality is it would have been negligent for me not to be responding to what has been asked. This gathering is not a byproduct of me doing anything as much as it is a byproduct of all that everyone is doing, everyone is seeking to do, everyone is exploring on how to work better together. So I don't want the credit to be misbalanced on where it should go. It goes in your hands. You are the ones that are going to be and are front lines at doing this. So if we can be a support in creating space for this connectivity to take place, for us to better utilize our resources and maximize the number of people served and alleviate the suffering in our community, that is our goal. So again, for time, I'm cutting it from everyone getting to share. I apologize for that. The next steps, as I mentioned, just so we have kind of clarity of like this not just being a call that was, a lot of information, is in our effort to streamline coordination, we're going to take this, we're going to then come back, hopefully by the end of the week, with a recommendation of where there's some natural grouping of organizations, both from what their focus area is as well as their geographic areas. And we are going to come back with some ideas of how we structure from here. What are the sub-teams that will be necessary to handle the different coordinating aspects? What's needed from all of you that are still with us is, if you have the capacity to take on any leadership role in being a lead of one of those teams or being a hub for some of the coordination, that is what's going to be needed. as mentioned, our role in this is to play a connecting the dots role, but everyone, and we're all in a reprioritization of our capacity right now. We don't be shy. Let us know. This is a thing where there's no territory. There's not need to yield to anyone else. It's we all need to do what we can with what we have. So we are planning though to have a weekly call. Initially, we may move that to bi-weekly, but we for now planning to do same time next week, Tuesday at 10 o'clock, our next call, and we will hopefully have some guideposts of some more actionable steps than we have even right now. So that's kind of our next steps. I'm in my chat box, so I'm not seeing if people are asking any questions, but again, drop questions in the chat box. I'm seeing people are still dropping information. That's really great. Don't want to keep you any longer. We're 14 minutes over. I'm going to keep you 1 minute more, and I want to just close with something that was shared in a meeting that I found very powerful to think about in our work. And that is a quote to kind of think about where we.
This is a long call. I don't think got that much to talk about.
So let me get folks muted real quick. So just as this is part of a quote, and I wanted to close with this for two reasons, because it's real, and because what Regina said early on about a COAD is that it needs to be beyond just this emergency. We need to have this type of readiness to mobilize and respond toward the future. And right now we're focusing on resource gaps, but it's important to keep attention to what were some of the reasons why we have resource challenges. And so those on the phone, there's 2 points to the slide. It's a quote by Adrienne Marie Brown that says, "I've been saying things are getting worse. They are getting uncovered. It is the age of COVID-19, already bigger than the intimate reach of 9/11, the Titanic, and many man-made and natural disasters. We've defined errors by. We are in history, and in a moment in history. And it's a lot to take in, but it's all about what we do in this unveiling. I've been dreaming that we hold each other tight and continue to pull back the veil to see both the wild wrongness in so many of our current structures and the wild possibilities if we apply our visioning, organizing, earthling selves to the conversation and pattern seeking." So I really want folks to hold fast to both how to take this moment in time to call out the wild wrongness and hold fast to the wild possibilities of what we can do as we continue to align better. Meet the needs of right now, but it doesn't end with right now. That this is about long-term. This is about meeting people's needs long-term, but then tackling the institutional and inequitable structures that have put us in a position where this level of response is needed. So wanted to end with that and just reiterate my deep gratitude for everyone's time and everyone's effort that's been going on. It is inspiring to say the least. And also just the fact that we just need this continued leadership to take hold. Please know that I'm steering, but this is a kayak with many different oars that need to be rowing. So please, everyone has opportunity to pick up that oar and help guide this as we go forward. So please reach out if you have questions, ideas, and know that more is to come sooner than later. All right. 11:47. I took you 17 minutes over. Sorry. But I thank you all, and I look forward to my inbox being flooded with ideas. Until then, you'll get a calendar invite for next week, and we'll go from there. Thank you all so much.
Thanks so much.
Thank you.
Great meeting.
Yep.
Thank you.
Worth the time.
Thank you, Evan.
Thank you.
Thank you.
Hey, Evan, I don't know if people saw, but they can save this chat. If you see where you would normally type, if you hit on the little three dots, it'll give you the opportunity to save it in a file to your desktop. So it's an easy way for people to go back and refer to numbers and stuff.
Okay.
Great, thank you. Thank you, Evan,
Thank
for
you.
everything. We'll talk soon.
Take care.
I'd like to see how to save them, the 3 dots.
Yeah, down at the very bottom where it says to everyone, and then it's got a little thing that says file, and there's a square that's got 3 dots in the
I
middle of
see
it.
it. Yeah, I was wondering what that was. I've clicked on it a couple times. Thank
And
you.
it'll save it to a
Evan has to
folder.
give us permission.
Thank you. Check
Evan-
saved. I got it. Thank you.
You're welcome. I think Evan can also, if he chooses to, email it to everybody, I think.
I think he was recording it. He's on mute, but I think that he was recording it to be able to send it out. So great.
Yeah,
This
I
is
think
great.
so. I
Thank
think
you
he can
so
just send a
much.
chat too, I believe. Thank you, guys.
Bye.
Thank you. Bye-bye. You know how to get off of here. Okay.